Much, Fiona, and welcome everybody. Thank you so much for coming. There are some familiar names, which is always nice to see. I'm Maya Kalogirou, and I am going to present to you today about a research project that I did. And basically, it was looking at green teams across Canada. What I'm going to be presenting to you today is not the full study with the full findings. I've been sort of breaking it up into, and I published one paper with sort of a preliminary set of findings, which is what I'm going to be talking to you about today. And it really is just looking at, just like a really general, what is going on with green teams across Canada? Who's joining them? What are they doing? How are they measuring success? Just like a really kind of broad snapshot. And the next kind of piece after this is looking in detail about like barriers and facilitators of what helps them and what hinders them, that kind of thing. So I have a very wordy title, but basically today we're just going to look at how Canadian hospitals actually support planetary health through the use of green teams and sustainability offices. I did this project as a postdoctorate fellow with Jennifer Baumbusch as my supervisor through UBC. So we're going to do a few different things. We're going to look at just, again, quick rundown of planetary health. I'm sure I'm preaching to the choir here. We're going to look at the global and Canadian contexts for planetary health and why the need for this study arose, or why I felt it was important to do this study. The gaps that I found. We're going to look at the research design briefly. We'll look at who actually participated in the study, and then the themes that came out of it. We'll look at some of the discussions and implications that arose from this data, and then there's going to be some recommendations for practice and policy, a conclusion, and some discussion questions for all of you. So I just see there's some people in the chat. Okay, I don't know, maybe Autumn or June, if you can just kind of look at the chat on my behalf, that would be very helpful. And if there's anything important, let me know. Oh, and the warning again is that I am dusting myself off from mat leave. I am still technically on mat leave and I don't have childcare today, but my son is sleeping. So as long as he sleeps at least like 45 minutes, then I am here. So everybody send good baby sleep wishes to my son. Now, starting with the planetary health imperative. Now, again, most of you probably know this by now. Planetary health is this concept that human health and the health of our natural world are inseparable. They are one and the same. Planetary health is really interested in climate change, pollution, biodiversity loss. So a lot of you guys are really thinking probably with like climate change in mind, and that is the number one problem, really. But it's just important to understand that there's a triple planetary crisis that planetary health is sort of offering a framework for. And, of course, human influences, like, or humans influence all three of these things. And there's just this cross connection. When we start talking about climate change, we also start talking about waste reduction and other pieces that are important for planetary health. They're not always directly greenhouse gas, reduction projects or actions. So in terms of the global context and eventually the Canadian, we know 4 to 5% of global greenhouse gas emissions are attributed to the health sector. The World Health Organization has identified 93 countries that have made formal commitments to build climate resilient and low carbon health systems. A notable leader is the NHS that has 2040 targets to reduce their emissions, to be net zero. And from, just looking at them, 93% of their staff have agreed that supporting the environment was important to do through their work and at work. And so that's really important, I think, because again, this is just one example, but it shows that there's an appetite for these types of things around the world, and it's becoming a bigger topic and a bigger issue. Also, just to frame this study and also, providing some reasoning for this is that when we look at quality improvement as health leaders and whatnot, we know that sustainability can be a very important domain of quality. And so what we want is not just a healthcare system that is helping people's health, which is of course the primary thing, but if we know that the health of the planet is also the health of humans, sustainability can be seen as something that is helping, the humans and the patients that we see, and it's something that's helping the environment. And that is all within healthcare's purview now, when we look at it through this planetary health, lens and through the sustainability as quality. In terms of the Canadian context, there are no existing policies or regulations or mandates or accreditation standards that compel hospitals to promote planetary health. There are some things in the works. We know behind the scenes here at the Canadian Coalition. We know that HSO, which is makes accrediting body for hospitals, they are working on some sustainability standards. But even those there are no plans for that to be mandatory. So this is I think a pretty big gap. And there's also this gap of, we know this stuff is happening, but we don't really know what is going on. So there's no mandate, and it is sort of happening piecemeal across the country. I think the Canadian Coalition is, of course, a humongous mover and shaker in this field, trying to make it less piecemeal. But ultimately, there's no legislation that forces it. So we don't know what's going on. The Academy doesn't really look at this area, but we know things are happening. And I really wanted to highlight what is happening in Canada right now in terms of what are we doing for planetary health. And the two major levers that I was thinking of really are sustainability offices and green teams. So that brings us to the purpose of the study, which is to really understand how Canadian hospitals support planetary health, again, kind of a broader term than just climate change, specifically through these two types of teams. I use interpretive description, which is a qualitative framework specifically oriented towards pragmatic and applied findings. There was an inductive approach. There were no predefined themes. Everything came from the data itself. It was only in Canada and only in hospitals. So if participants were working in a Canadian hospital and were either part of a green team or a sustainability office, they were allowed to participate. And the way that the data was collected, it was sort of this multi-phase thing where first we set out surveys. The surveys did ask some preliminary questions, collected demographics, and then there was a piece right at the end that said, do you want to participate further in an interview? So if they were eligible and they said yes, we would contact them. At the end of the day, we had 29 participants join for the interviews, and that's where that data, the presentation, like this one right now, is based on the data from those interviews. The data was collected between April and July 2024, and we used thematic analysis to sort of unpack that data. In terms of where participants came from, so we had, you can see sort of just on the slide here, most were from either Ontario or BC, but we did have a few people from everywhere except for the north. We had several different professional roles. We had nurses, we had pharmacists, we had hospital managers and leaders. We really tried to make it as open as possible. And so we had 20 people identify that they were green team members. We had 4 people identify that they were part of a sustainability office. 3 people identified as being in both, and 2 people identified as other. So I'm going to get into the themes of the findings now. Again, this is based on the interviews. And this first theme really explores how participants defined and distinguished between green teams and sustainability offices. These two structures represent fundamentally different approaches to planetary health promotion within hospitals. And we will get to it, but effectively one is really bottom up and one is top down. And so we're gonna just look a little bit more deeply into that. So green teams versus sustainability offices, there are some key distinctions. The table that you see in front of you shows the key structural differences between the green teams and the offices as described by participants. So green teams were fundamentally volunteer-driven, bottom-up structures with a broad planetary health mandate. They covered things like waste diversion and composting to operating room emissions. Their strength was really in culture change, engagement, and agility. Sustainability offices, on the other hand, were formally embedded resource structures led by energy and sustainability professionals. They operate at a much more macro level, managing building infrastructure, procurement, and data management systems. However, their mandate is often constrained by financial sustainability considerations, which was a tension raised explicitly by participants pretty much over and over again. Really, the key insight here that I think comes from this work is that, you know, these are complementary structures. They're not substitutes for one another. They do different work, and spoiler alert, they work best when they actually work together. So the second theme really looked at operationalizing this work. So we sort of moved from defining, what the green team was versus what the sustainability office was, and we really wanted to look at what were the makeups of the teams. We didn't dive into sustainability offices mostly because they were pretty homogenous in how they were embedded, but the green team was the Wild West. Like there was no rhyme or reason. Everyone did what worked for them and what made most sense, and we're gonna look at those differences. So we have 5 structures of green teams. Now, the first one is the single person green team. This was the single champion that did it all, right? They were highly motivated, but very vulnerable to burnout and institutional invisibility. They got people to bring in their recycling, and there were no structures to support them. So they personally took those recycling things in their car and drove them where they needed to go or whatever. So we did come across a few teams like that where it was just really one champion that just really believed in the mission. The second exemplar is the health profession specific team. So this would be something like just nurses or just pharmacists, and they really focused within their scope, which was great, but they did not, it limited their broader organizational reach. If it was a pharmacy team, it was just what can pharmacists do to promote planetary health, right? And that's not to say that their impact was small, because we know that medications do have a pretty big carbon tax allotted to them. But it was more just within the organization that, yeah, they just couldn't go further than what pharmacists can influence. In terms of the third exemplar, this was a unique one. This was a pilot project. So this was a sustainability office. This was a project where they wanted to implement sustainability offices, and there was sort of this higher level team that managed them. So they had these little, like 2 or 3 pilots of green teams in different settings, and they did have some larger organizational support. The hopes was to expand that. But it wasn't these green teams working alone. These green teams would report back to the team. They would say, this is what we're doing. This is what we want to do. Maybe we need a little bit of money for posters or things like that. And so we're starting to see, green teams having support that are outside of the team themselves, higher up in the organization. Then we have another type, the fourth one, the penultimate exemplar, which is that some green teams actually had external partners. These green teams would partner with community partners or other physician groups that were perhaps provincial physician groups, and they would work with them to say, like, this is what we're doing in our hospital. How can you help support us? Or, maybe with education, what do you kind of getting guidance from these external groups saying, oh, what do you think we should be working on within our green team at the hospital? And what do you think is feasible and possible? So they weren't necessarily directing the team, but they were helping with networking and trying to just guide some activities and just offer some consultation and things like that. The final exemplar is what I have identified as the most effective one, which is the bottom up meets the top down. So leadership in this case was actively embedded or very closely connected to the green team. this was identified, as I said, as the most effective model, and we're going to talk about it more in this next slide. But really, it was a green team that was acknowledged and supported, whether it was financial or otherwise, by the Sustainability Office or by leadership or both. So when it's bottom up, the frontline staff and volunteers are generating ideas and championing initiatives. They're directing knowledge of unit level sustainability opportunities. They bring enthusiasm and energy and grassroots engagement to drive broader culture change at that level. And the members choose the initiatives that they're personally passionate about often, and that helps increase ownership and follow through. But then there's the top-down support, where there's organizational authority that facilitates cross-departmental reach. Again, these green teams are often isolated to their units or their profession, so they're not able to see what is happening across the hospital. Having a sustainability office or supportive leadership involved gives them access to data and sometimes budgets, executive support as well, which is very important to help accelerate implementation. It acts as the bridge between green team and senior leadership. So that also helps visibility of the team. And yeah, leaders wearing multiple portfolio hats can support virtually any initiative depending on who they are, right? They're opening doors for them. That's the key. They know who to talk to when you need something, and that is like having that up, that bird's eye view is was very, very helpful to the green teams to get things done. And I have a little quote just from one of the participants, and it was from a hospital manager that was on a green team. And basically, they said, "I think it's because we're empowering people to lead their own initiatives, but we're acting as a support for them." Right? So it's sort of the green teams are doing the work that they're passionate about, and they're getting that support. So again, this was the most effective model. And in terms of some of the planetary health initiatives identified, I sort of categorize them into, these four categories. There's the waste reduction, the greenhouse gas reduction, energy and infrastructure, and then education and culture. I won't go through all of these. I'm sure many of you are already familiar with a lot of these actions. But you can see that, which ones were led by green teams most often and which ones were led by the sustainability offices. There is one, I hope you can see my mouse, sustainable procurement programs. That was also sometimes led by green teams, depending on the context. But there was a lot getting done. And it was amazing to hear about the work that's happening right now that again is just not really always captured, but I think that's also part of what this hub is about, or that was sort of the dream for this hub. It gave people an opportunity to meet and connect and talk about what they're doing, the challenges they face, and learn from each other. So yeah, really amazing work out there that was captured in this study that I'm really grateful to have learned about. So the final theme was really about paving the path forward and tracking progress. Now, that is a challenge that probably many of you already know about, which is the question of, how do you know if this work is making a difference? And that is an open question that, there aren't a lot of answers to right now. And I think that that's changing, but teams across the country were really navigating the metrics challenge. And so this is like from knowing what to measure and having actual tools to measure it, and then connecting that as well to local actions and those local actions to larger scale outcomes. So basically, the sustainability offices, their metrics were really about energy use, intensity, and associated emissions, right? Some people there was this emerging data management system with the hope of tracking certain pieces of greenhouse gas emissions. People were reporting to provincial and federal authorities as well. So they knew what they needed to measure and track, which again, like it was often greenhouse gas emissions, and because they had to report it up. And then it was just in general much more linear and established measurement infrastructure in place. The green teams, again, Wild West, a much broader range of metrics, looking at waste volume, waste diversion, plant-based food uptake. They looked at maybe cost savings when they could, or patient satisfaction as a measurement of success. Staff engagement was also, being measured. It was highly variable. Different teams track different things at different levels of sophistication. Many of the teams were at very early stages and still defining their KPIs. And really, really informal tracking was very common. And that's not to say that that was a bad thing. Again, a lot of these teams were pretty new within like the last 5 years at the time of the study. They had just been established. And so really, when it comes to measuring success and all of those things, I don't have necessarily recommendations in terms of what we must measure, but I am showing what people are measuring, and that success can look different depending on where you're coming from. Again, I think patient satisfaction and staff engagement are two very important measures of success that have nothing to do with greenhouse gas emissions, but they are relevant to the sustainability of green teams. And just a quick note about quick wins. This came up a lot when I talked to green team members. It was a really pragmatic and useful finding, because that's what often people used to keep them going, right? So participants across all team types described deliberately choosing high visibility, low barrier initiatives first. These are kind of like the Peachtree model that I'm sure we're all familiar with. This is like the low-hanging fruit stuff, right? This is recycling, reusable cups, reducing plastic. Not because these are the highest impact actions, but because they built relational and cultural foundations for more ambitious work. And so I have like one quote here from Celeste at the bottom. And you can see once you get there, you'll want more, like we did. You will want more. And what Celeste was saying is that success begets ambition. Teams that achieved early wins, they gained confidence, they were more organized, and they gained support from leadership over time because they showed that they could get things done. And so for hospital leaders out there thinking about how to support green teams, creating conditions for early success really does matter. And simple structural supports like recognition and actually showcasing, wins, all of those things, giving them access to data and meeting spaces and offering ways to, help them to get those early wins really can accelerate a team's trajectory. So, what they really wanted to do initially is build momentum, start changing the culture, and just start to build this ambitious appetite for more. Now, the case for integration. So the core, thing from this part of the work is that we need sustainability offices and green teams to be connected and engaged also to each other and with leadership. This is the most effective configuration if we want to support planetary health in Canadian hospitals. Now, again, these structures are designed to do different things. You do need infrastructure level change and cultural clinic level change. And one without the other leaves really large planetary health gaps. Yeah, again, if we're kind of trying to push for planetary health. Another thing is this greenhouse gas trap. I know that greenhouse gases are the number one thing that we need to be thinking of. I have been in this field a long time. I get it. But it is, again, when we're trying to shift culture, it is important to expand that view. And it might not necessarily be, maybe yes, greenhouse gases still, and they need to remain at the forefront, but just opening up those things to looking at, how do we support biodiversity and water and soil? How can we get maybe even gardens at the hospitals that patients can spend time in and spend time in nature, which we know is healing. This is all part of planetary health, and this is stuff that green teams can take on and do with support. So maybe it's not a sustainability office project, maybe, but it still can be done. And, a green team is a perfect lever to implement such a thing. Finally, the leadership. Leadership is so, so important. The data were very clear. When leaders are genuinely connected to green teams and not just, sort of aware of them maybe from a distance, the reach and the impact of those teams grows substantially. Green teams must include leadership, and they really must include people from the sustainability office so that they can work together, so that they can not double up the work, and they can really amplify one another. That is the biggest takeaway, I would say, from all of this. So this was not part of the paper I published that I'm presenting to you about, but it is sort of a bit of a sneak peek at what's to come in the next one. Obviously, there are barriers to sustaining green teams in the hospital setting. And, because I have the ability to talk about this right now, I'm going to, but it's voluntary labor. These are people who just they care about this and they want to do it because it matters to them. It brings them joy and value to bring their what is typically their personal values of being like a sustainability person. They can bring that to the workplace now, and that's really valuable in many ways. Again, that's that staff satisfaction piece, but also they're doing it because they love it, and that makes them vulnerable. It makes them vulnerable to burnout and high turnover. These are practitioners that have a full-time load. These are people working in admin that have a full-time load, and then they're doing this off the side of their desk. So something there needs to change. And maybe said more clearly is that these need to have financial backing. So they need to have budgets. They need to have, the people who are volunteering need to have time and compensation for this work because it is valuable work. And if we don't pay for it, then people are just not going to do it. They need to do, they're too taken up by their other main jobs. There is the metrics deficit, of course, that does make it difficult. Like, what is a successful team? That is a bit of a barrier. I think it can make things feel overwhelming for people as well. It also makes it difficult to know how much progress is being made. But that's something that I'm hopeful that when you get organizational support, and a sustainability office I think could step in here too. I think that there are some solutions there for teams that they can work together on what are we measuring, how are we measuring it, and what does success look like? There is this tension, again, that sustainability offices specifically face between the environment and financial goals. Really, they're trying to reduce emissions often, but they're doing it because it saves money. It's like we're trying to reduce our energy use because when we have LED bulbs everywhere, we just actually save on utilities. So there are sometimes conflicts there. Uh, and I'm not sure if that's something that can be changed, but it is a barrier ultimately at the end of the day. When leadership isn't there, when there's no policy in place, that of course is a challenge, and I've spoken at length about these things. And then capacity gaps. Like I said, a lot of these teams were only 5-ish years old. There were some older ones, for sure. There was, I think, one that was even like 10 or even older, 10 years old and older than that. But a lot of these folks, they're doing it and they're learning as they go. They don't necessarily know what they're doing in the sense of like they got no formal training. They're just doing it because they know it's the right thing to do in their hearts, and they're just kind of figuring out as they continue. And that's not to say that they're doing a bad job. They're doing incredible, many of these folks. But it is a capacity gap that needs addressing in education earlier before health professionals, for example, enter the workplace, but also at the workplace. Professional development opportunities and things like that. So it's just some barriers there. And some implications for policy, practice, and research. On policy, the most impactful systemic change would be embedding planetary health into accreditation standards and into mandates and guiding documents for hospitals. The mission and the vision and the values, like embedding planetary health at all levels, at that really high level guiding documents. That to me is like one of the biggest changes that we could make, and that I think it would trickle down and transform, what's happening at the ground level of these hospitals. Regarding practice, leaders can act right now. toolkits exist. Protected time costs relatively little compared to the cultural environmental returns, and leadership participation in green teams is free and it's powerful. Making time for that and honoring that time and compensating that time appropriately for everyone, that to me is, it's a huge takeaway here. And then on research, we do need agreed upon definitions of success at some point. We need validated metrics and longitudinal data. This field is just beginning from an academic perspective. And so there's a lot of opportunity here for health systems research to support that as well. I'm just looking at the time, strengths and limitations of this study. I'm just going to focus on the limitations, but yes, it was just Canadian hospitals. So we don't know what's happening in long-term care facilities. We don't know what's happening out in the community setting. So that's something that needs to, be studied as well. There was a limited sample size. There's no long-term outcome data available. Again, there was high variability among the structure of green teams, which made it a bit difficult to make direct comparisons. And then member checking was intentionally not conducted, which is consistent with the methodology. So to conclude, the study demonstrates that Canadian hospitals are already doing meaningful planetary health work through these different teams and offices. The findings do point to what clearly is working, which is the integration of structures, engagement of leadership when it happens, and expansion beyond greenhouse gas reductions towards a more holistic planetary health perspective. And I will sort of end this presentation here with just a call to action for Canadian health systems leaders who are on this call today. And basically, you are healthcare leaders in Canada at a moment when planetary health is, just becoming increasingly more important. And it's gaining significant institutional momentum globally. But in Canada, there is no mandate and no standard and no regulatory floor. So what exists in Canadian hospitals right now exists because individuals like the ones that were in my study are passionate, they showed up, they did it voluntarily, and they do it on top of their existing jobs. So, that is important to acknowledge and understand. What this research shows is that your engagement as leaders, direct, visible, and committed leadership, it's not just helpful, it's actually the number one thing that differentiates teams that are achieving really large scale achievements and those that sort of plateau at like recycling programs. Again, not to say that, like, not to poo-poo recycling programs, but there's the peach tree, right? So that's it. That's my presentation. I have